Okay, the number of attendees is going up.
Dr. Phelps, is it possible for you to send or someone to send me a link for this recording?
Yeah, I think so. I think Samantha knows how to do that.
Okay, I'd appreciate it. At some point.
Okay, yeah, we're hoping to put it on the website as well.
Okay.
We'll give it one more minute and we'll have at it.
We got, how many we got? Big numbers?
No, so I'm showing 18 right now.
Okay, that's good. It's a good start.
I said the world's worst. They flew me to Missouri to give a talk to physicians, and no physicians showed up. So, so I talked to the staff. So you got a low bar to get over here. All right. Well, I am showing 12:02. And I would like to say good afternoon. I'm Dr. Greg Phelps with Hospice of Chattanooga and the Chattanooga Association for Clinical Pastoral Care. And this is our 4th annual Book of Life seminar. This year, the theme is looking back to see our way forward, reflections on the pandemic, and health inequities. And we have 3 great sessions set up. The first is Dr. Mary Lambert, who on my screen is at the bottom of the screen, and she'll be introduced in a moment. Next week, we have Faith, Leadership, and Crisis with the Episcopal Bishop of Atlanta, Bishop Robert Wright. And then on October 25th, we will have Looking Back, Reflections on the Pandemic, Inequity and Faith, and that is going to be a panel discussion of area clergy. And COVID has really taken a lot out of the community and has caused a lot of damage. And so we're going to look first locally with Dr. Lambert, a little more nationally with Dr. Wright, and then with the panel, we'll be reflecting again on local impact. I would like to mention that you can ask questions in the chat. And with that, I'm going to stop and turn it over to Dr. Lambert, who will be, actually turn it over to Nicole Brown, who will introduce Dr. Lambert. Sorry.
No worries. Thank you so much, Dr. Phelps, and good afternoon, everyone. My name is Nicole Brown. I'm the manager of Community Benefits and Diversity for CHI Memorial, a proud sponsor of this series. And I just have to be honest and just tell you how honored and excited I am, not only just to be able to share with you, but just because we're moments away from hearing from the one and only, the phenomenal Dr. Mary Lambert. And so I have the honor of introducing her. And I'm not going to read everything on her bio because we would be here all day before we got to hear from her. But I do want to share a couple of things because she does have an impressive range of experience for our topic today. And our topic is the pandemic in Chattanooga, how communities can address disparities and misinformation. And somebody in the amen corner can say amen on that. And so I want to start by letting you know that Dr. Lambert is the inaugural director of community health for the city of Chattanooga. She has a long history of service and programs providing healthcare needs and addressing public health. She's had assignments in Washington, D.C., also included with the Assistant Secretary of Health, a detail for the White House, yes. And also she's had deployments in the nation's capital area after the 9/11 attack on America and in response to the National Capital Anthrax Exposure event. I remember all of that and how impactful that was to our country. Dr. Lambert has served multiple assignments in leadership with the Food and Drug Administration, also the Centers for Disease Control and Prevention. Not only that, she's managed more than 780 staff and an operating budget of approximately $1.6 billion. That's a lot. Plus, she's advised our city on the COVID-19 response and our approach. Dr. Lambert has a doctorate from Vanderbilt University. She's a graduate of Emory University. And I want to back up and say that's with an MSN. And she has a degree from the University of Tennessee at Chattanooga. And that's her BSN. And she's a nationally certified as a clinical nurse specialist for community health and in advanced administration. But that's not all when you talk about Dr. Mary Lambert. She's also an associate professor at Vanderbilt University in the School of Nursing, where she teaches public health policy and epidemiology, where she is passionate about her students. And I must say that I learned a lot about what a 0-6 means in the Army. Where I'm going with this is Dr. Lambert is retired as a full colonel from the Army, from active duty, November 1st, 2012. During a media interview in April, Dr. Lambert stated that we've got to get COVID under control because there are a number of pressing issues making our community sick, such as heart disease, diabetes, access to quality care, mental health, and closing the gap when it comes to health disparities in underserved communities. You are about to witness and hear Dr. Mary Lambert as she discusses the pandemic in Chattanooga, how communities can address disparities and misinformation. Please join me in welcoming Dr. Mary Lambert.
Thank you so much, Ms. Brown and Dr. Phelps. I appreciate the opportunity to be with all of you today. And I appreciate the opportunity to take a look back at where we've come through this, how we've come and where we've come through this pandemic. I'll add just a little bit more of my background just so that you have some perspective on how I have approached and how I view this pandemic and how we can get through it and how we are getting through it. As Ms. Brown indicated, I did have 2 assignments on active duty at the Centers for Disease Control and Prevention, as well as 2 assignments with the Food and Drug Administration. And both of those assignments with the Food and Drug Administration were regulatory positions where I was involved with the review of new drug applications for the approval of new drugs, as well as applications for the approval of new vaccines. So I'm fairly well, my perspective on vaccines is very colored by how stringent, rigid I know the regulatory process for this country, which is among the most, if not the most stringent in the world, is in making sure that drugs and vaccines are safe and effective before they are approved for use in an emergency or as a full licensure in this country for our citizens. As well as the assignments at the Centers for Disease Control included one assignment with the National Immunization Program, so very familiar with the National Vaccination Program activity through the federal government, as well as an assignment as Chief Management Official for the Emergency Response and Preparedness Program at CDC. So very familiar with dealing with large-scale emergencies of a health nature, natural and some man-made disasters in this country. It's a pleasure to have these kinds of conversations. I will try not to sound too professorial, and I chose not to present slides, so I will be talking primarily. So I appreciate it if you've got questions, if you'll pop those in the chat so we can go through those as I finish my remarks. Again, I appreciate the opportunity, and I'm so grateful to Dr. Phelps for the invitation to present today as a part of the Book of Life series. I did want to go through some background related to COVID-19, the COVID-19 pandemic in Chattanooga. I returned to Chattanooga after retirement from active duty in 2012, in late 2012, and began to teach part-time, to volunteer at the VA clinic, and to try very hard to make myself useful and to use some of the great experiences that I had the privilege of receiving throughout my career thus far. I tell folks often that I retired from active duty service, but I did not retire from service. So I'll continue to do that and continue to figure out how to serve my community. Fortunately, there are plenty of opportunities. As we got to late in the year 2019, I began to hear from some of my colleagues, there's something going on with this virus that we're hearing about. We're not sure. We're a little concerned with what it looks like, how it's moving, that kind of thing. Now, this was December of 2019, and that's why, of course, it's COVID-19, because that's the year it was identified. I was also involved with, providing seminars, providing presentations for health seminars, primarily for a number of organizations. And with one organization in particular, we were planning for a seminar for elderly individuals on health and how to maintain their health, et cetera. And it was an in-person, of course, at the time. This was pre-pandemic, essentially. It was for individuals who would be in person. And this was early part of March of 2020. I was increasingly concerned about the wisdom of that, because what I did not want to happen was that organization or anyone else would be affiliated with having been the source of the spread of this virus to the individuals who were attending in person, almost all of whom were 65 and over. So I had quite a struggle with the information that I knew, with the colleagues that I still have at FDA and at CDC, who were letting me know that there was something going on and that we need to pay attention. We did go forward with that seminar, but I actually and we had about 35 people in attendance in person, sitting close together at tables as we always used to do with these seminars, these kinds of gatherings. And I held my breath for at least 2 weeks until I was sure that we were beyond where we would start seeing cases. The virus, and I know we're going to have a presentation on the national picture, but I just always have to mention that this is the 5th pandemic after the 1918 flu pandemic that this country has experienced. And I think people lose sight of that. My experience at CDC, the work that I had to do there, has informed me very well of all of the health-related crises that this country has experienced. The pandemic, the COVID-19 pandemic, by far the largest and the most deadly, but certainly not the first one that we've experienced. Interestingly enough, from the Spanish flu pandemic in 1918, when reviewing some of the historical records, it does seem that we are having some of the same battles, some of the same challenges related to having folks wear masks. We did not have a vaccine for flu at that point. Some of the same battles with people protesting against wearing masks, that kind of thing. If you look at the footage, if you look at CNN documentaries, and there's actually quite a good one by CNN that compares the two pandemics, 1918 flu and our 2019 COVID-19 pandemic. quite a few similarities. It seems that 100 years doesn't mean that we'll necessarily, with 100 years space between those two major those two pandemics, does not mean that we will learn the lessons. Hopefully we will from this one. The growth was quite amazing in the Chattanooga area as far as the number of cases, hospitalizations. We also, as you probably, most of you remember, we had challenges with the availability of protective equipment. I'll step back to my CDC experience as a chief management official for emergency preparedness and response. One of the areas of responsibility was for the Strategic National Stockpile, which then was organizationally under the CDC. I happen to have some knowledge of what was in those Strategic National Stockpiles, but with administration changes and some policy decisions and some budget changes, the resources that I know were there for years were not there when this pandemic, when the COVID-19 pandemic hit. So that hit nationally, internationally, and it certainly hit this community. This community is blessed in that we have 3 major hospitals, CHI Memorial, Erlanger, and Park Ridge, but that still doesn't mean we necessarily have the supply of all the things that we need when we hit a pandemic the way we have. Then the shutdowns and the impact on this community were certainly wide-ranging, as you would expect them to be. Health as well. Health impacts just about everything. So it impacted businesses, impacted schools, impacted churches, places of worship, other places of worship. So many impacts impacted our healthcare system, impacted the ability of individuals or the willingness of individuals to get the routine care that they needed, screenings and whatnot, to be seen when they needed to be seen because of fear. Some of that occurred because of some of the misinformation. And as we moved along the timeline in this pandemic in the Chattanooga area, we, along with the rest of the country, had to learn, had to be informed by the science. And being informed by the science means positions and recommendations may change depending on where we are with the science. It continues to do so to this day. We also have to battle the misinformation and the myths that were there. I mean, one of the first myths that I recall hearing was that, and this was before a vaccine was available, an approved vaccine was available for COVID-19. I recall having to discuss at length the myth that if one took a certain pain medication, if you developed COVID after taking that pain medication, you would likely die. So that long conversation to encourage the individual to dig a little deeper and let's identify where the source of that information and what science, if any, that myth was based on. So in the space of this pandemic in this city, I have, and many others have had to have many long conversations regarding the validity of some of the information that's received. So throughout this pandemic, one of the key factors in how well we do with fighting this pandemic, with getting past this pandemic, is the kind of information that's there. We've had some great campaigns in place to try to educate the public and educate folks on how to protect themselves foremost when we did not have a vaccine. And but the protection of yourself is still important, is important now. We've got 3 effective vaccines, one of them fully licensed, but none of those vaccines offers 100% protection from COVID-19 infection. So there's still a need for the protection, the masking when you're indoors, spacing, the hand washing, the sanitizing of frequently touched surfaces. All of that's still important, along with the vaccination. The vaccination's our biggest hope in getting to at least a 70% vaccination level for our total population in this area, in the Hamilton County area. Is very, very important to get us past this pandemic, to get us to where we can begin to go back to some of the usual, the ways that we were able to operate pre-COVID-19 pandemic. Early signs and the beginnings of this pandemic in this city were amazing to watch for someone like me, and I'm sure there are others who have had some experience with working outbreaks of one kind or another. In addition to the flu pandemic in 1918, there was also the Asian flu, 1957, the pandemic flu, the influenza A virus in 2009, the Hong Kong flu in 1968. So it was amazing to watch how quickly and how widespread, and the measures we had to take to get control of it. And then some of the policy discussions related to shutdowns, mandatory masks, all of that, which go on, right, that are still going on now, closing the schools, remote schooling, remote classes for students, college careers interrupted, weddings, funerals, everything totally disrupted. To see the changes that went on in this city regarding those kinds of things of life that we tend to see, vacations, birthday celebrations, celebrations of all types, not being able to do those things, incredibly taxing. So that I think once we had an approved vaccine, I know it was an emergency use authorization, which does not mean that it's experimental. To get even the emergency use authorization through the FDA and the other bodies that have to take a look at the evidence, it does have to be proven safe and effective. And yes, there may be some side effects. They're generally mild, but it is approved. It is not experimental. The experimental stage is the clinical trial stage, and that's where you get full full information so that you can make an informed, so you can give informed consent to participate in the clinical trial. But once it gets an emergency use authorization approval, and if you've been watching the news, you probably saw the steps that it went through initially, and that it's still going through the CDC advisory committees, the CDC director, advisory committee for the FDA commissioner, and indeed, because those two organizations, the CDC and the FDA, are under the executive branch of our federal government, the White House approval as well. So lots of steps and lots of, I sometimes describe the process of reviewing new drug applications, new vaccine applications as an almost, not that I wasn't very interested in it, because I was and I still am, almost a mind-numbing review of the data that's submitted to support an approval. To get that kind of thing in place so that we could get some vaccines in this city. And if you'll remember, our initial shipment, once they were approved and were available to Tennessee, we received our shipment from our supplies for this area, for Hamilton County, from the state. And of course, naturally, because it was being produced once it was approved, it wasn't as much as, it wasn't enough to meet the demand. So there were the first 2 days, and some of you may recall this as well, the line to receive that vaccine, and the first age limit was 70 or older or with certain pre-existing conditions. The line was incredibly long, and the vaccine for that first day was gone very quickly. And the second day, folks started lining up. I don't know whether I don't think I'm the only one that remembers this. Folks started lining up to get their drive-through vaccination from the county, and the vaccinations. And before the vaccination line opened, the announcements were going out for folks, if they were not already in line, to please, they had already counted up the 1,000 or so, I believe it was 1,000 each day, at each of those first 2 days. They had already allotted for the individuals who had already driven up, identified themselves, and were going to get the vaccine. So hundreds of people were turned back until our vaccine supply stabilized. Vaccine supply stabilized, lots of folks vaccinated initially. Those are the ones who were absolutely ready for it, willing to be vaccinated. Those numbers have slowed down considerably. In addition to the health department and the hospitals, lots of nonprofits have been involved in supportive of vaccinations for individuals in this community, especially once we had a vaccine supply that was very reliable. The city's Office of Community Health, a new Office of Community Health, which was established by Mayor Kelly, was part of his platform during the campaign, was established so that we could pay attention to focus on some of the populations where we knew there would be an even greater impact by the COVID-19 virus, which seemed to have, and it still does, have great negative impacts on populations of color and on individuals with populations with health disparities, whether that be diabetes, hypertension, some other cardiovascular condition, immune system issues. This office was set up to really partner with nonprofits, private entities in the community, as well as with the health department, the hospitals in the area. We're still getting up and going. We are using the community health centers for the city, as well as the public library. The community health centers were not community health centers, but the community centers in the city were formerly known as the YFDs, or the Youth Development Centers. We're utilizing them for vaccine clinics. They're closed for most other activities, but they're open for vaccination clinics at least once or twice a week, and we're trying to grow that just to make sure we get opportunities for vaccination into the communities that we know need them most, because their numbers are low. We are now at about 50% fully vaccinated within Hamilton County, but if you drill down into specific population segments, those percentages are not 50%. And remember, what we're trying to get to is a population totally vaccinated of at least 70%. There are sometimes folks who say, well, it's got to be more than 70%, and there may be some who will say less than 70%, but that's what we need to get the protection that we need for the total community. The area-wide impacts are still ongoing as far as schools. I can't tell you the number of school principals that I happen to know, have talked with, and they talk about the challenges with the people who test positive and what that means for those in the student's classroom, for the teacher. We've lost teachers, we've lost young individuals who had perhaps pre-existing conditions but were not vaccinated. The unvaccinated are absolutely a challenge. Sometimes that status of being unvaccinated has to do with access, and sometimes it has to do with those individuals having misinformation, having nothing but information that's basically myths, that's totally not true. Individuals who have been told, sometimes by health professionals, that the vaccine is still experimental, or that it was still experimental before Pfizer received full approval, or not full approval, but full licensure. So the unvaccinated individuals in the community, particularly in our minority communities, where we have a long history, decades of knowing that we've got health disparities that we need to address, those will still need to be addressed once this pandemic is behind us. But while we're still in this pandemic, and along the entire timeline of this pandemic, the most negative impact, infections and deaths, have been among these minority populations. So our goal is to educate ourselves, to stay current with the science, and to bring the vaccination opportunities to ask questions about vaccines to trusted individuals within their community regarding what does this mean? I've heard this, I've heard that. In fact, my and the individuals that I work with and with some of the nonprofits, our best time is spent with individuals answering their questions, providing them information. Sometimes they'll make the decision at that point to take a vaccination, to consent to a vaccination. And sometimes they go away and they come back to the next clinic, and that's okay. The point is to get them. We don't have to see thousands in a line, but we do need to make inroads on those individuals in communities who are unvaccinated. Because remember, we do have what they call breakthrough infections with individuals who are fully vaccinated. It's one of the reasons that we're now moving towards vaccination for children age 11 to 5, as well as booster vaccinations for individuals who have the complete series of vaccinations more than 6 months ago. I'm among the pack who are ready for my booster. We also in this area are being impacted by, and may be impacted by what some are calling a twindemic with the flu season starting. We basically did not have much of a flu season last year because we were shut down for the most part. Folks were masking, they were distancing, they were not gathering, etc. That is not the case this year. So it's very important for us to urge individuals and to think about it ourselves to get a flu vaccination if we can, and those are readily available. The vaccine supplies are out there. The high dose for those 65 and over who have pre-existing conditions, and then the regular vaccinations open. I know companies are doing that locally through their occupational health resources usually. They're available through the local pharmacies, and there's no cost. And you often don't have to have an appointment. And I know the health department does those as well. Our current status in the U.S. in Chattanooga has been one that has grown and has been impressive in the number of individuals who have stepped up and who have decided that they wanted to do something. From the very beginning, we had organizations such as the Community Foundation of Greater Chattanooga partnering with the health department to, when we had no vaccine, they partnered and identified churches and had drive-through COVID testing so that we could at least identify who was positive, who was negative, so that we identify, if we know that your status is you're COVID positive, then we know that there's potential that you're spreading. And there's a need to quarantine to make sure that you're protecting yourself and protecting those around you. But in just one short summer, last summer of 2020, that partnership between the Community Foundation and of Greater Chattanooga and the health department led to the testing of nearly 8,000 individuals in just the space of the summer. We can do that same kind of thing now and offer those vaccinations, those approved vaccinations in communities the way we did with those churches or other community organizations. We could bump up the percent fully vaccinated in some of our minority communities and our communities where we know we have health disparities that make for very, very poor outcomes. In this city, currently, many of the hospitalizations and deaths from COVID are among individuals who are unvaccinated, and they're fairly young, and we're beginning to see them in children. So the importance of vaccination among the youth who can be vaccinated, those 17 to age 12, as well as vaccinating children once there is an approval for a vaccine for children ages 11 to 5 is critically important. And until then, the masking, the other protective measures that we can take are very, very important. Considerations regarding gatherings, how many people we have indoors. The temperatures are going to be cooling off. We're coming up on holiday season. seasons, multiple holidays where we have the gatherings, and because of temperatures in this area of the country, they're mostly indoors. We have folks traveling, people coming in, people going out. The spread is a function of, the folks that we're around, the folks that are traveling in and out, what part of the country they're coming from, the vaccination level and the infection rate in those areas of the country, and they're moving around. It's almost like the perfect storm we had after the 4th of July and Memorial Day holidays, where things were opened up, people were traveling, people were gathering, and then we had the spike again. And those numbers have gone down now. What we don't want to see is those numbers go up again, because we're all back in school, we're traveling, things are opening up, people are gathering more. We've got holidays, we've got folks traveling. I think the schools are on, I may be thinking about my grandson's fall break, but the schools are about to have their fall breaks. And then we'll have November with Thanksgiving and Christmas. And we've got flu, and let's layer on that the flu season. And we're not as protected as we were as I said before, we're not as protected as we were last year. So we've got to beef up we've got good responses going now through the health department, through some of our private partners, certainly through this office, the Office of Community Health for the city of Chattanooga. But we need to keep that up, and we need to keep educating ourselves, and we need to continue following the science. And we're looking forward to when we will have vaccinations for other segments of the population that are at this point not able to be vaccinated. The guidance that we need to follow needs to be those reliable sources of information. The Centers for Disease Control, academic, and their website is incredibly helpful. I encourage folks, if they have not sought out that resource for themselves, spending a bit of time with that, not a whole lot of time, but a bit of time just to get familiar with it. There are updates every week or two, and based on the latest science that helps guide us in going to school, going to church, gathering, holidays, travel, all of that, so that we can protect ourselves. We need to be doing that locally. We need to continue to do that so that we don't experience another spike, and so that we can move past this pandemic into the things we need to be doing. But the guidance, the reliable, I always like to talk to folks about the sources of reliable information and how important that is, both for professionals, health professionals, science folks that have a science background, as well as for individuals who do not have that kind of background. Need to be very, very well informed, because it's for their protection, for their health, and for the health of everyone that they know and care about. The myths and the misinformation, those need to be, sometimes individuals don't know that that's a myth, or that that's some misinformation that's not based on science. I think we need to get very used to questioning the source or sources of any information that we receive from that might be a myth, might be some misinformation. Where did that come from? Is that from the CDC? Is that from a university or an academic medical center? Is that from a Vanderbilt University? And we've got great institutions in this area. Is that from an Emory University? Is that from a Johns Hopkins or Stanford? Where's that information coming from, and what's it based on? It's worth it to take the time to really research that for yourself. Share that kind of information. Share that kind of information on Facebook, and share the source. I'd be grateful if folks could share the source of the information that they are sharing through social media related to this pandemic, actually about anything that's shared that way. Incredibly important. I generally spend quite a bit of time in my presentations when I'm asked to present to churches and other community groups, the importance of reliable resources for guidance, source of information, regularly reviewing those sources of information for any updates. Again, those updates from those reliable sources is going to be science-based. It may change. And, for folks not to get too frustrated with the fact that sometimes things will change, or the guidance or the recommendation may change a bit. So we need to make sure we're doing that. We do not think this will be the last pandemic that we're going to see. Hopefully it'll be the last one of this magnitude that we will see in more than 100 years, in before the next 100 years is up, and that we will also learned all that we should have learned from this pandemic, and that we're still learning the importance of being prepared, the importance of having, and under preparation, we would put the, protective equipment, the science, and how we inform people, where information comes from, how to make it as reliable as it can be, as current as it can be, and coming from sources that are trusted by the individuals receiving the information. I really would like to, encourage folks to question and address their sources of information, just to make sure that it is from reliable sources. And it's okay. I've gotten information that hasn't been the most reliable, but I will lean on, and it's not just my background, and I will lean on going back first to either an academic institution or to the Centers for Disease Control website for their information. I think I mentioned already the challenge that our local hospitals are having at the time with the COVID cases, so many of them being unvaccinated individuals. And it's really heart-wrenching when they're fairly young individuals in their 40s or younger, and we lose them because they're unvaccinated. And they're unvaccinated because of the information that they've received or myths that they've received. There are divides in how this pandemic has impacted this community based on, there's a racial divide, the racial groups. And that's the underlying with that is the health disparities that have been long known and long documented and long talked about in this country. Probably one of the greatest privileges for me since coming back to Chattanooga, and then having been given the opportunity to work through with the at the beginning of the COVID-19 pandemic, was to meet Chris Ramsey, a local health advocate, very active, very passionate. We lost him way too soon. I got to know and work with him for less than a year before we lost him to COVID-19. But the thing that I saw with him was the passion around the communities of color, addressing those health disparities. And then once we were addressing the pandemic, addressing the measures that needed to be taken to identify COVID-19 infected individuals. And then once the vaccines were available, I know he would be at the front of the line, encouraging folks, urging folks to get vaccinated. I often think about the fact that this pandemic is probably I consider it the third war that I've had any part in. The first one was the first Gulf War. I was on active duty. And as a preventive medicine officer in the Army, my job was vaccinating individuals to protect them from the diseases that we knew they would face when we deployed them. So that was many, many, many thousands of vaccinations to troops as they were being deployed for the first Gulf War. The second war for me was the attack on America, 9/11. I don't know where many of you were, most of you were, but I can recall the second that I realized we had something going and the measures we had to take to respond to that. And then the third war for me has been this pandemic and what we've had to do to get through and to address it initially, to get through it, and to get to the other side of it. And I don't believe the war will be complete until we have institutionalized, encapsulated the lessons that we've learned from this pandemic so that we're prepared for the next one, or that we're prepared to prevent the next one. And there is a way to do that. I think we've got some great people who are working on that. and I hope to continue to be a part of that. I don't have very much. We're going to end a bit early. I would love to address, and there's so much to cover. We could do a day-long seminar just on the Chattanooga area, the impact, the history, the timeline, the responses, and et cetera, related to the COVID-19 pandemic. But I'd love to hear what your comments and questions are. And I see we have about 25 people on with us. So I will, Dr. Phelps and Ms. Brown, I will leave it to those I'd love to answer some questions if I can. I prefer doing that than a lot of talking. But at least I didn't, you didn't get the death by PowerPoint that I usually give to students.
We appreciate no death by PowerPoint. I had one question for myself, and that was if you could comment. We've heard the physicians even saying things like the vaccine will magnetize people or it's a microchip. What are your preferred sources to go look at, like PolitiFact or whatever, to look up what the disinformation that's being put out? Where do you like to go?
My go-to, and it's probably because of my background, is the CDC, the Centers for Disease Control and Prevention. And that's because I still have some colleagues there. Their website, having been on the backside of their website and how information is deployed and how often it is reviewed, updated, that kind of thing, and the reading levels that it's at. There was a requirement for it to be at certain reading levels so that the citizens, it was available. It wasn't a bunch of large words and scientific jargon, that kind of thing. That's my first go-to, but I am also, because I'm an academic as well, Vanderbilt University, Emory University, Johns Hopkins, Bloomberg of Public Health, School of Public Health, academic institutions, CDC, FDA's website, the Office of the Surgeon General, the Office of the U.S. Surgeon General. So all of them have that kind of information, and they're consistent. They're pretty consistent. Some of the others, I always want to know where the individual's information is from. I know folks have YouTube videos that they look at. I would look at them, but I would want to know the background of the individual who's producing and putting out the YouTubes with information. One of the most curious recently, a few months ago, that I received was information that more than a few individuals were receiving, that 5,000 individuals had died from the COVID vaccination. My immediate response upon first hearing that report from an individual was, not in this country. Not in this country. And there are some vaccines other than the 3 that we have currently approved in this country that are not approved in this country. And there's probably a reason for that. So, but CDC would be my first, but yeah.
So there's a question in the chat, but I also have a question too, if I could, Dr. Lambert. And by the way, thank you so much for the wealth of information. But you mentioned something earlier about Chattanooga, Hamilton County having 50% vaccination rate, and the target should be 70%. What can local businesses do to kind of encourage the 70% rate?
Incentives are nice, especially since we've gotten through most of those who were chomping at the bit to get the vaccine when it was first approved, emergency authorization approved. Incentives, I know some businesses have done that. I know the city does that. The city has an incentive for employees. There's a countywide incentive through the city, Vax4U. At the website, you can go on the city's website and you'll see that. And so when individuals are fully vaccinated and documented, then they're entered for the sweepstakes, and it's a weekly drawing through, I know it's through December, maybe more than that, but you can go to the city's website and look at that. But incentives, education, information, opportunities for employees to ask questions, whether that's of their occupational health, service, or whether the employers bring in someone to speak. I've had some of the videos from some presentations I've given used in staff meetings at small businesses And, myself and many others who are working in this battle together are quite happy to present, especially since it's so easy to do it by Zoom, Zoom in or video, whatever. But local businesses encouraging their employees. And then there's an enter into the discussion regarding mandated vaccinations. There's some businesses that are doing that. We know from the news, the recent news headlines, there are some businesses, some big ones too, who are requiring to maintain your employment, are requiring full vaccination.
I'll go ahead and get to the question that's in the chat. What do you think is the most important lesson our community has learned about public health as a result of the pandemic? And there's a part 2. What makes you hopeful about the future of public health?
Okay, first part of the question is, say that again. I want to make sure I get it right.
Yeah, sure. What do you think is the most important lesson our community has learned about public health as a result of the pandemic?
As a result of the pandemic, I know that we have learned from having met with both mayors. One of them I meet on a almost daily basis, and many individuals with the health department, the past administrator, and many healthcare professionals, is the importance of being prepared and the critical importance of information, timely, accurate, trusted information. Those are the biggest lessons. If we're prepared, and that's from my CDC experience, if you're prepared, it doesn't mean that you won't have some challenges, but if you're prepared, you're better off than if you're not prepared, you don't have enough supplies, the vaccine's not ready yet. If we've got vaccine, we don't have enough vaccine clinics out there around the community that can get to people, especially those people who need the vaccine. I won't say they need it the most, but these are the ones whose vaccination rates are so low that we really need to make sure we get to them. But yeah.
And then there's a part 2 to that. What makes you hopeful about the future of public health?
What makes me hopeful about the future of public health is that I know that correctly informed policy related to public health is always a win. And it impacts absolutely everything. One of my lines in my first few lectures in public health policy is, all policy is health policy. There's a need for public health. There's a need for us to embrace public health. There's a need for us to understand the value of investments in public health. We can build all of the medical centers that we want, but if we can prevent by keeping people healthy, or as healthy as they can be, we have saved a lot of resources that could go into other areas of our society, of our city, businesses, community development. There's so much more we could invest in if we invest first in the public health. And I think that lesson has been driven home to many, many individuals. I think it'll be a while before folks don't take a long, hard look at and have more appreciation for the value of public health in a society.
Love that one. We have another question too. And it says, how can we successfully address the mistrust that leads to people deciding not to get vaccinated?
I think the first and probably the most important element is engagement. Engaging those individuals, not in arguments, but engaging those individuals to get to the root of where they're in, the source of their information. And then second would be getting that accurate information, and as much as possible, particularly in some communities, having it delivered by trusted sources, trusted community leaders in their communities of faith, having that information, that accurate information delivered that way. But I think, when we get into the arguments, and I have been confronted with some very troubling misinformation and myths. And that's where we all have to, stand tall and hear the person out, and then persuade the person with the correct information, and then follow up. What's your community? Can we come to your community center? Can we come to your neighborhood association, so that you can ask questions, so that we can provide more information, providing information from, we can download and use all the information from the FDA, the CDC's website, that kind of thing, making sure that's available, or that we spread that as wide and far as possible in culturally sensitive and language appropriate ways to individuals, so we can get that information out. But it's not about the arguments we have, it's about the dialogues, the discussions that we have to provide that information, and to back up the information we provide them with the science that's there.
Are there other questions from the audience?
I have one more if we're waiting, Dr. Phelps.
Go for it.
And then it'll be my last one, I promise, because I'm so passionate about this topic. But when you think about our non-native English-speaking residents in Chattanooga, Dr. Lambert, and misinformation, what type of, I don't know, well, we know some of your challenges, I'm sure, but how did you address our non-native English-speaking residents in Chattanooga with making sure that they were informed about the vaccine, where to go, and things of that nature?
Outreach. We have to reach out to them in the language that they need us to reach out in. Follow up with them, provide them with opportunities for as much information as they need, and for opportunities for vaccination, and for the information about how to protect themselves. Because remember, even vaccinated, you're not at 100%. And I think that's the myth. That's probably the latest myth that I run into the most, is folks who are fully vaccinated and they're in crowded indoor venues, and or they are exposed, or they just, if there's two people together and they both are, and one is vaccinated and one is not, the one that's vaccinated is thinking that they're fine, they don't have to worry about it. So it is making sure that we get that information to those folks, getting information and opportunities for vaccination to those folks as well. That's part of the mission for this office. We have a $3.4 million grant from the Department of Health and Human Services Office of Minority Health. And we are going about the business of getting vaccination opportunities and information and awareness and an outreach campaign to communities throughout Chattanooga, whether they're English speakers. We have partners who are able to support us with that. Some of the staff that we're bringing on through the grant, one of the requirements that we list in the opportunities is that, preference is for someone who's bilingual. So we're actually looking for that to staff. And if we can't find them for staff, then we will partner with the individuals we need to make sure that that's available in a way that is understandable and will be received by those communities.
Thank you.
Well, do you have any concluding comments you'd like to add?
Concluding comments is that we've come a long way. We've come a long way in Chattanooga from the first case, and I believe the first case, or among the first cases in Chattanooga, documented cases, was an individual from the faith community. So we've come a long way from the panicked testing, because when we had no vaccine, to the rush to get the vaccine once it was initially approved, to now getting over the myths and the misinformation and continuing to vaccinate folks. And in particular, the need for the focus on communities where there are health disparities and where their vaccination levels are well below even 50%.
We did have one more question in the Q&A section, and it was, what do you think will be some of the emotional and mental health fallout from the exhaustion of our medical health care professionals and employees from this pandemic?
Just that, emotional and mental exhaustion. We have lost and are losing some healthcare professionals who just cannot do it anymore. I was on the phone with a mentee a couple nights ago, and she was describing what she has to do when she comes home from the inpatient facility she works in, as far as her little boy wanting to run and hug her immediately. And she keeps him at bay while she takes her shoes off, changes clothes, showers before she can go in and greet him. The impact of that, the trauma, the impact of that, just emotionally, for healthcare providers in particular. There is a bit of a bright side in that we've had a number of individuals who have determined that they desire to learn more, to work in healthcare, potentially, and to educate themselves. So there's a bit of a bright side there. We've got people who want to know more, and that's a good thing. I think if we can educate lay public, elected officials, government officials, if we can educate them and provide more information and more of a grounding and understanding for them of science, of infectious disease processes, those kinds of things, informed policy and informed laws make the best policy. So, but to be you've got to have the information to be informed. So I think we need to do a bit more work in that area.
Thank you.
Welcome. Thank you.
Nicole, any parting comments from you before I wrap us up?
I would just encourage everybody to share with your friends, to register for our upcoming sessions. Just like today with Dr. Mary Lambert, you will be informed and be able to encourage other residents in our community. And just, I'm looking forward to the other sessions.
Great, thank you. Dr. Lambert, I want to thank you so much for this informative talk. And I really appreciate your analogy of this being your third war. I want to thank our board. It's not just Nicole and I. We have a whole board of health and spiritual professionals that have helped us put together this series, and their institutions are noted on our website. And we do have additional sessions next Monday and the following Monday, and I think that we'll have a wonderful opportunity to hear more speaking about the intersection of health and spirituality. So thank you all very much for attending, and we'll see you again next week. Thank you all very much. This is great.
Thank you. Thank you.
You want to stop your recording, Dr. Phelps?
Let's see if I can do that.
You can do it. I have all the confidence in you.
Okay, it says stop recording. Are you sure you want to stop recording? You will receive an email when the recording is ready. Yes.
Oh.